Good afternoon. Thanks so much for joining us today. I'm Sergeant First Class Joshua Blair. I am a healthcare recruiter with Vancouver Army Medical Recruiting. We support the state of Oregon and Southwest Washington. I'm a licensed practical nurse as well, and today I'm here to talk about our programs in clinical psychology. So we have a variety of different programs we're going to go over, and I'm going to be here to answer any questions anyone might have about these programs as well. So Army Clinical Psychology is a member of a huge team of different specialties that help support the health and welfare of military service members, veterans, and their family members. Our clinical psychology team takes care of around 3.5 million patients, anything from behavioral health issues to major psychological disorders. They help healthcare providers deal with different aspects of patient care, other healthcare providers, and they help soldiers reintegrate coming back from combat. They help family members deal with the stressors of deployment and everything having to do with military life. They're an extremely valuable member of our team, and they're on a team making up soldiers, civilians, other doctors, and enlisted personnel. So we have a couple different programs. We have the Health Profession Scholarship Program, and that is a 1 or 2 year scholarship, full tuition with a living stipend. This applies for APA accredited doctoral programs in clinical psychology, and you get this living stipend of over $2,300. There is also the Clinical Psychology Internship Program. You can apply for this program directly to go to an Army internship at like Madigan Army Medical Center or any of the other vital medical centers. You get full pay and benefits as a captain while you attend the Clinical Psychology Internship program. So another program that we have as well, after the Clinical Psychology Internship program, you could look at either the postdoc supervisory program, which is the clinical psychology residency that the Army offers. Those are going to be done in the same sites as the clinical psychology internship program if you're applying from CPIP, but you can apply for it as a direct civilian as well. Full pay, you come in as a captain, you get benefits as well. Another option that we have is the Financial Assistance Program. The acronym spells FAP. That one is a $45,000 grant, and you get the monthly stipend of $2,300 a month. So you attend a civilian internship, and then you go into a postdoc supervisory program at a military hospital. On top of that, we have direct accessions for fully qualified clinical psychologists, and you can get loan repayment, you can get bonuses, special pay, and a variety of other different things. And those are offered for both the reserves and active duty.
Forward?
Yes. Okay, so I want to walk through the career timeline. So if you can see this properly, this walks you through year 1 of clinical psychology until the end of the cycle. It looks daunting when you look at it, because when you look at this, it says, my goodness, I'm going to have to be in the military for 12 years. No, that's not what this slide's saying. What this slide is saying is these are your 4 years of clinical psychology school. And then after those 4 years, you go to an internship. And then after that, you go to a year-long postdoc. And then once you finish that, you owe 3 years to the U.S. Army as a clinical psychologist. There's other things on top of that that you can do if you want. We offer fellowships. There's quite a few that I'm going to go over, and those are a 2-year time commitment if you decide you want to do that. But after all your education, what you'll owe the United States Army as a clinical psychologist is 3 years as a clinical psychologist and another 2 if you decide to go to fellowship. So right now I'm going to go into the overview of the Health Professions Scholarship Program. Basically, it's a 1 or 2 year scholarship. It only covers your last 1 or last 2 years of your clinical psychology program before internship. So you're either going to apply for that program in year 3 and it'll cover year 4, or you're going to apply for the program depending on your program structure. So it'll either cover year 3 and 4, or year 4, or year 4 and 5, or year 5. It just depends on the program you're in, because there are some 5-year programs. So when you look into that, you apply the year before and it'll cover your next year. So if you're in a 4-year program and you want a 2-year scholarship, apply in year 2. If you want a 1-year scholarship, apply in year 3. The good thing is it's rollover. So a lot of the work that you do, if you don't get accepted that first time, it's going to work for the next year if you want to apply again. A lot of the folks I've worked with have applied several years in a row and got it. So if you apply and you don't get accepted, don't give up. So the scholarship covers full tuition, books, stipends, fees, everything that your PsyD program requires. If you're in a 2-year scholarship, there's an option that you can go to the active duty training during the summer. The 1-year scholarships will get that opportunity as well, but usually the fall. So there are interview placements. You do get precedence for being an HPSP student, but it doesn't guarantee you an internship slot. If you're an awful student and you don't do well in the program, you probably aren't going to get an internship site. So if you want to go do an internship site, you have to be competitive. So the clinical psychology internship program, it is a full pay internship with the United States Army. We have multiple different sites. You get full benefits. You come in as a captain. If you're coming from HPSP, you get promoted as a captain, usually in DCC, the direct commission course, and then you start clinical psychology, the internship program, as a captain. It's a 12-month internship, and you have a 3-year service obligation, but that's going to start after your postdoc if you go to the postdoc. There's an expectation for you to do that. You get paid between $75,000 and $90,000 while you are in this internship program. Sometimes it's as much as $100,000, depending on where you live. It's based on the cost of living, because you might have an internship site in San Antonio, Texas, and you might have one at Joint Base Lewis McChord near Seattle, and the cost of living there is much, much higher. All right, so here's a rundown of some of the sites. We have 4 sites. We have San Antonio, Texas. That's Brooke Army Medical Center, Tripler Army Medical Center in Honolulu, Hawaii. I've been to both. They're great bases. We also have the Wabamsi. That's in Fort Bragg. That's in North Carolina. We also have Madigan Army Medical Center, which I talked about a little bit earlier, and that's in Tacoma/Seattle. So the other program I'd like to talk about, that's the financial assistance program. That offers you a $45,000 grant, and you get a monthly stipend of $2,300 a month. This program is for people entering their APA accredited internship for their PsyD, a civilian internship. So while you're going there, they're going to say, here's 45 grand, $2,300 for a monthly stipend. But after that, the expectation is that you're going to go into that postdoc program and work at an Army hospital for 3 years. So the postdoctoral residency program, that is a full pay residency program. You get between $75,000 and $110,000, depending on where you're at. The clinical sites are essentially the same: Madigan Army Medical Center, WOMAC, BAMC, and Triple Army Medical Center. MAMC and WAMC are both APA accredited. BAMC and TAMC are not, but it doesn't affect anything at the postdoc level. Civilian applicants apply during their internship for this position. It's a great residency. They do have specialties as well. So fully qualified clinical psychologists, we have positions available in active duty and in the reserve. Active duty, you'll be working at one of the major medical centers or a behavioral health clinic. You're going to commission as a captain to start, or you might come in as a major, depending on experience and other education. You'll have the option to get bonuses, loan repayment, and other incentives. These are regularly available, but they change depending on manning requirements and our mission each year. This is a rundown of our fellowships that are available. We have quite a few. There's some at Brooke Army Medical Center in San Antonio, and some of our residencies are, we have pediatric, neuropsych, trauma and healthcare delivery. So there's quite a few of these available. Now, fellowship does add an additional 2 years to your contract. You can get that if you come into HPSP. It's something you can apply for down the road. Or if you come in as a direct clinical psychologist, you can apply for this fellowship as well. So this is a rundown of what makes our candidates competitive for this specific set of programs. And really what it comes down to is they want someone that's very involved in clinical psychology. In the field of psychology, they want to see evidence that you're active in research. They want leadership positions. Depending on which time you're going, they want to make sure that your dissertation is proposed, submitted, defended, accepted, depending on where you're going. That can help you be really, really competitive for your CPIP program or your postdoctoral supervisory program. They want people with excellent GPAs, usually 3.5 and above, depending, that's undergrad or graduate. Other things that are going to make you competitive. Now, it depends on when you're applying, like what set of cycle. If you're going for HPSP, what you're really looking at is a certain set of hours. So you'll have to do a list of clinical hours and experiences, and that has to be signed off by your education, your academic trainer. So the person that's in charge of all clinical training would sign this off, and they're going to sign off on your hours in each category. So you need to match the hours required from a facility. Like Madigan Army Medical Center might only want 400 or 500 specific hours and then 100 of a different form of hours. So you want to match what they're requiring to get into that specific internship. And the same thing for your postdoc. They want you to have at least 2,000 clinical hours. Other things that are important, they want to make sure you're a good communicator, whether that's written or verbal communicating. They also want to make sure that you have the writing skills to be effective as a clinical psychologist. So you might create a sanitized clinical observation as part of the application process. They want to make sure you have those skills. That's mainly for HPSP candidates, not necessarily for fully qualified clinical psychologists. They're generally, you guys are vetted. You're going to have to do an autobiographical essay, and you're going to have to create a professional CV, a curriculum vitae. All that needs to be well worded, well written, concise, no typos. When you do a lot of the background information for this application process, you want to make sure that you mention and, in interviews and when you write stuff down, that you're motivated to serve in the Army. You're motivated to be a clinical psychologist. You're motivated to serve the military community. Those are important factors that we look at. If you're not really motivated to do those things and you just want to go in for clinical psychology, it can make you less competitive. I've already talked about leadership positions. You want strong letters of recommendations from clinical psychologists, from academic counselors, deans, anyone in that sense. If you can get letters of recommendation from military clinical psychologists, it looks really, really great. For direct or interns, anyone coming on at that stage, you don't want any type of history of disciplinary action. For direct providers, especially when you're looking at malpractice suits, history of disciplinary action can be tough to overcome. All right, basic program requirements. Active programs, you need to be a U.S. citizen. That's for all scholarship or training programs. For any reserve program, you can be a permanent resident. So permanent resident or fully, nationalized or U.S. citizen, you can come in to any active program. If you want to do this program, you either have to be enrolled or graduated from an APA accredited clinical psychology program. A lot of our applicants who have applied in the past didn't graduate from an APA accredited clinical psychology program, and unfortunately, we can't work with them. So make sure that's something, you're on that track. Already talked about good GPA and clinical experience. Of course, you have to meet the basic requirements to commission as an officer in the United States Army. That means you have to meet all height and weight requirements, no serious medical, legal, or moral requirements to overcome. So once you get all that information, you meet all those hurdles, you can apply for any of those programs. Thanks so much for coming in and meeting with us today. We also have a set of interviews that we just talked with 2 military Army clinical psychologist students who are in their internship phase and who are inside the HPSP program applying to internship. Tune in and see what they have to say about the program as well. Thanks so much and have a wonderful day.